Hi everybody, how's it going today? I'm in a pretty good mood right now. I don't know why. I think I'm just, I got over a really scary event yesterday. I had to go and have an MRI. I have severe anxiety, so I had to take 2 Valium in order to subject myself to this horror. But if you don't have phobias, you're gonna be just fine. It's easy. Nothing, it doesn't hurt or anything like that, but it was quite the adventure for me. So I, kind of walked into this room, and it's a giant tube and little hollow tube in the middle on a bed that slides in there. And they laid me on my tummy, plopped some headphones on my ears, and played some yacht rock, which I love. That helped out a lot. The Valium didn't hurt either. And they put an IV in. And then they ran some contrast through there so they could see what was going on to make sure my lymph nodes and stuff were clear. So I'm crossing my fingers. I'm really, really hopeful that they don't find anything there. But so I did that yesterday, and I came home. I was pretty whacked out of it from the Valium, and I slept all day. But what I wanted to talk about today was your diagnosis. If you're diagnosed with cancer, what happens. And I'm going to be specifically talking about breast cancer because that's my experience. If you're suffering from cancer in other forms, other places, there's going to be things that are going to be the same for you, but just, maybe, you'll want to investigate other people who have videos that are talking about something that's more specific to you. But in a general sense, pretty much, how it begins seems to be the same from what I've heard. So when you get diagnosed, you're either going to be at your OBGYN or you'll already be at a women's breast health center. My family physician had referred me over for my mammogram and ultrasound, so I pretty much remained there from that point on when I met the surgeon who did the biopsy. So she kind of picked up the torch from there. It was very overwhelming. It was very emotional. It was scary, devastating. I was angry. I was in tears. I couldn't breathe. I was just, it's just really super intense. But they hook you up with a coordinator. And that coordinator pretty much, she's going to talk to you, or he is going to talk to you about what kind of services do you want other than your medical care. For example, if you want counseling with a counselor who deals with oncology, if you want a dietitian, if you need to lose weight, gain weight, whatever, they can navigate you through that and schedule you for those things as well. Let's see what else. Then the definites are radiation oncology, that's for radiation therapy. Your hematology, that's for the chemotherapy. And then your surgeon. And, it seems kind of really overwhelming because you're like, how do I navigate through all this? Don't worry, someone's going to help you with that. If they don't, please ask your doctor, hey, is there someone that you can hook me up with that can navigate all this for me? Because it's just too overwhelming for me. I wasn't really mentally present when they were, when she was talking about my diagnosis on my breast. So it was really great that I had a coordinator to handle all of it. And if I have any questions, I can call her anytime. So far I've seen the radiation oncologist. I saw her 2 days ago. And she did a physical examination of me. She took a look at my breast, and then she felt all my lymph nodes. She said that she didn't feel any swelling, and that was very good news. So that's why I'm pretty upbeat today. But the MRI is just to be certain that there is nothing in the lymph nodes. So please cross your fingers, send out positive vibes, give me some prayers, whatever. I'm eternally grateful for all of you. I will know the answer to that on Monday. If you're wondering what this clunky thing is, I'm done with it. Really, it just shut off. But I just had a spine fusion of my L3, 4, and 5 vertebrae. And I have to wear this fabulously clunky thing for 2 hours a day for 4 months. Yay me, huh? But my back is starting to feel a lot better, which is great. You know, when I got this diagnosis, I was like, are you kidding me? I literally just am starting to feel better from spine fusion that I got February 3rd. And now there's this. So it's like, can I catch a break here, guys? Come on. But yeah, so I wanted to talk to you about that, about the navigating, you know, the navigator that can help you with everything. So don't worry. There's just this whole group of people that are going to take care of you. One cool thing that I wanted to mention is in my neighborhood, I live in Akron, or the Akron area, and there is a place called Stewart's Caring Place. Okay, and that offers all kinds of stuff for people who are diagnosed with cancer, if you're going through your treatment, if you're a family member of someone who is going through this, they're there for you. They offer group support, they offer holistic care, family programs, group fitness and yoga. I'm a big fan of yoga, right? So that's definitely on my to-do. Wigs and beauty. You know, part of my journey is going to entail chemotherapy. You know, I'm going to lose all my hair. You know, I've never really been, I don't know, I mean, just losing all your hair is a heck of a lot different than cutting your hair short. You know what I'm saying? So it's going to be really rough to be bald. So they offer wigs and beauty, which I think is going to boost, you know, I think it's wonderful to boost our self-esteem levels. You know, it's hard, it's just, I don't know, we'll see how it goes for me. I don't know, I may be crying for 20 minutes on YouTube, so who knows. Financial and legal counseling, a food pantry if you lost your job, you know, to help you, webinars, different events, friendship, peer-to-peer, you know, where you can talk to other women who are going through the same thing as you, or men. Don't forget us, you guys. I mean, you know, breast cancer affects us all, right? So you don't have to live in Akron, but I'm sure that there's other places near you. Definitely ask your doctor about it, because I think that's a really positive thing that can help. So what else did I do? Well, I have an appointment with a dietitian. I spoke with her on the phone yesterday. I weigh about 110 pounds, so I need to beef up. So she recommended that I eat 16 to 1,800 calories a day. I'm a one meal a day kind of girl, so, you know, I've always been pretty petite. So there will be a dietitian if you want it, you know, to help you with your eating habits and stuff, to keep you healthier, to at least to get you started on being healthy if you're not already healthy, you know, to eat those nutritional foods. So that's fantastic. Tomorrow I see the hematology specialist, so they're going to talk about my chemotherapy program. And then on Monday I go back and I see my surgeon to find out how the MRI went. And then from there, then we figure out what the plan is. From what I've been told, it's first you do chemotherapy, then surgery, either a lumpectomy or a mastectomy. Right now they're talking about removing my whole breast. So I think that if that's the road that I need to take, I'm going to have them do both, because I'm kind of one of those people, I need balance, and I don't know, part of me thinks, why risk it? Why risk, you know, having the same thing happen again in this breast? You know, let's just do the whole thing and try and save up for some reconstruction surgery later in my future, after I survive this, get through this. Then after that, they finish up the program with radiation, at least for me, you know, not everybody's going to have to go through all three things. You know, initially we thought that I was going to have to just have surgery and then possibly radiation therapy afterwards to make sure that everything is gone. But my blood work or my biopsy came back, I'm HER2 positive, which means that I have a more aggressive form of cancer. So they're going to want to do radiation for me. Also estrogen positive. So this is an estrogen fed cancer, not like sugar. I know a lot of times you hear about starving the cancer with sugar. Well, from my body, it's starve the body of estrogen. Okay, so I can eat all the sugar I want, which is good, especially if I have to gain all this extra weight. Okay, don't really know if there's anything else that I wanted to cover today, but if anyone has any questions or anything, go ahead and comment that down below, and I'd love to hear from you. Hit like, follow, subscribe. Can't wait to see you tomorrow. Have a great night. Bye.